they held me and cried with me and just listened and got me through that time there. And my husband. Another hard thing was because it was COVID. I don't know what we would have done if we would have had my son come meet him or not. I think we would have, but that wasn't even an option. No family could come meet him or anything.
Mm-hmm.
So I just remember when it was time to like leave, that I've been through some hard things. That was the hardest thing I've ever had to do.
Mm-hmm.
I just remember like, how can I leave my baby with these strangers? And then we did request an external autopsy. I couldn't think about having an internal autopsy done, but we did say yes to the external autopsy. So it was just a struggle though, just picturing him down in some like cold cadaver lap. And I just remember thinking, is he lonely? Is he cold? Like, you know, like giving him all these human attributes even though he wasn't alive. It's just...
Welcome to The Rainbow Connection. This podcast was designed for mothers who are finding their way through life after loss. Whether you're grieving, trying to conceive again, newly pregnant, or holding hope in your heart for what's to come, this space is for you. Each week you'll hear real and tender stories of love, heartbreak, healing, and the babies who continue to shape us. I'm your host, Kristin Mundy, a mother, doula, and a woman who's walked this path too. May these conversations remind you that you are not alone, that your baby is never forgotten, and that hope and grief can live here together. Before we dive into today's episode, I want to tell you about Mother Like No Other, a special community for women who are navigating the tender season of life after loss. Inside Mother Like No Other, you'll find a warm, supportive space of moms who truly get it, plus practical tools to help you through the hard days. You'll have access to a private online community where you can connect with me, an experienced doula, and other moms navigating the same journey. Each month, we gather for live workshops to connect and learn, covering topics like supporting your fertility journey, grounding strategies, self-advocacy, and ways to nurture your mind, body, and soul. We also bring in guest speakers to share their expertise and inspiration. The best part? It's only $22 a month. No long-term commitment, just real support when you need it most. If you're ready to feel more grounded, connected, and held through this season, come join us at thedoulalife.ca/mother. You do not have to go through this journey alone. And by joining us inside Mother Like No Other, you won't have to. Today on the Rainbow Connection, I'm sitting down with Nancy. She is a local mama to me whose story holds both a lot of deep love and a lot of deep loss. She shares about her son Callum and the unexpected diagnosis during her pregnancy that changed absolutely everything for her. We talk about navigating that uncertainty, what it feels like when joy turns into fear, and how she found her way through a pregnancy after loss and into motherhood after loss. Nancy also opens up about her rainbow baby journey and what it looked like to carry hope alongside grief all over again, even when it felt scary to do so. Now, this is a conversation I know so many of you will see yourselves in. I know I saw myself in it. All right, well, enough from me. Let's hear from Nancy. Hello, everyone, and welcome to the Rainbow Connection. Today, I'm joined with Nancy. Nancy, thank you so much for being here.
Thanks for having me, Kristin.
Oh, I'm really looking forward to learning all about you today and hearing more about your motherhood journey. This is actually the last official recording of season 1 of the podcast, and it feels really nice to be, finishing things off with a local mama. So I'm really looking forward to chatting with Nancy today. She is going to be sharing 2 stories with us, one about her angel baby and about her rainbow baby, and a little bit more of what her journey to and through motherhood has looked like. But before we dive into that, Nancy, why don't you just introduce yourself to our listeners a little bit more?
All right. Hi, everybody. My name's Nancy. I live in Oakville, Ontario. Been married to my husband, Cody, for 9 years. And I'm a proud boy mama to my son, Declan, who is 6, my son, Landon, who's 3, and my angel baby, Callum, who'll be turning 5 in November. I'm a teacher, and in my spare time, I just love being outside with my kids. I play soccer. I love to read and garden and just be with family and friends.
I love that. It sounds like we would be good friends because all those things sound amazing. Well, Nancy, I would love to hear more about your story. So wherever you feel good starting, we would love to hear it.
Okay. All right. So I found out we were pregnant with our son, Callum, in the summer of 2020. So it was weird COVID times. We weren't trying to get pregnant with him. In fact, we didn't feel ready for another baby yet before we found out. Like having our first kind of rocked our world. So it was on the radar, but we weren't trying. And then we found out we were expecting him, and it just felt, okay, well, then this is how it's meant to be. And we were really excited right away about it, and told his big brother, and just everyone, it was a lot of joy in that time. So in my first pregnancy, I was followed at a fertility clinic because I have PCOS and low progesterone and whatnot. So I just automatically did the same thing with Callum's pregnancy. Returned to that fertility clinic, and everything seemed fine. Around, I forget, like 14 weeks or so, I switched over to my midwife. I had a new midwife, and I met up with them, and I remember her saying, "Oh, I'm so sorry about your blood work." And I said, "I have no idea what you're talking about. Everything's been fine." And she said, "Oh, your blood work shows that you're positive for CMV." And I said, "Well, what is CMV? Like, I've never heard of this. What does this mean? Does this even matter? Like, you know?" And she told me at that time that, so CMV is a virus, it's cytomegalovirus, which can be extremely risky in pregnancy, especially if you contract it in the first trimester. So I had the virus, and they look at your, like, if it's like, they call IgM and IgG. So IgG markers would mean you've had it in the past. IgM would mean you're, like, currently experiencing the virus. So I had the IgM, not the IgG, meaning it was my first time having this infection, which also really increases the risks.
And this is your fertility clinic that found this?
My fertility clinic did the blood work and did not report it to me, didn't tell me anything about it.
Okay.
So they did it at like 6 weeks, and then
Gotcha.
I learned about it at like 14 weeks. So it just came as this, like, what the heck are you talking about, you know? And it's not something that even is, like, normally tested for, apparently, but at the clinic they just test for more things. So I don't know. Anyways, yeah, so then the midwife said, it could mean nothing. It doesn't necessarily mean it will pass to the baby, but we want to refer you to MFM at McMaster anyways. So that's like, well, you've talked about it before, but high risk maternal fetal medicine, OBs. And so that's what happened. I went there, I think, around 17 weeks for an ultrasound. And it was a very long ultrasound. And at the time, I just tried to tell myself, like, oh, this is like such a high specialized place. Like, they probably just are so detailed and, whatnot. But I remember the ultrasound tech, like, she'd leave the room, and then she'd come back, and then she'd leave again. Oh, I just need to go consult with someone, come back. I'm like, this is just, it felt strange. And then went upstairs to meet with the OB, and at that time, I was told, baby's measuring okay, but he has, well, we didn't know the gender, but baby has severe echogenic bowel. So you might know more about it than I do, but basically his bowels were as bright as bone, which can be like a soft marker for a lot of different, like, chromosomal abnormalities. It could be a marker of the fact that he's has an infection, such as
Mhm.
CMV. And they told me sometimes it just resolves itself. So, that's possible too. So I had that little shard of hope at that time.
Yeah, because I always say if you look more and you look deeper, you're going to find more. And like some of those times it can be bright as bone and it can go away. Like, so if you're
Exactly.
looking more, doing more investigation, sometimes you find things that would have been a non-issue or resolve themselves.
Exactly. And actually, after the fact, I've had a friend who had her baby had echogenic bowel at the anatomy scan, and it did resolve itself. So it doesn't necessarily mean anything. So I had that bit of hope, but then they said, we'll have you come back in 3 weeks and we'll scan you again and see if there's any changes, see if it's gone away. So in that time, I was just trying to convince myself that it's just going to go away. I'll go back. It'll be fine. And we'll move on with the pregnancy. And so I returned 3 weeks later for another scan, another long scan. And this time we learned the echogenic bowel was just as bad, bright as bone. And bright as bone is the worst it can be, basically. Also at this time they noted that he had IUGR. So he was small for gestational age, whereas he wasn't really measuring small in the first scan. He had a small head for gestational age. They found some fluid around his heart and his abdomen, which is a sign of high drops, which is really risky in pregnancy. And I think what they would have said at the time was the biggest issue was that he had blood flow issues from his placenta. So it was a sign of fetal anemia. So obviously it was very upsetting to hear all this, but we're still well, what can we do about these things? These things sound like something that can maybe be fixed, or I don't know. And so at that time, they decided to refer us to Mount Sinai, which is even more specialized hospital in Toronto, for their professional insight, and also to get an amniocentesis to confirm whether or not the baby, the CMV virus had crossed the placenta to the baby. So that was maybe a week or so later that we went there. This was hard because it was, again, peak COVID, and they didn't want to let my husband into the hospital with me at Mount Sinai, and very traumatic. Fortunately, we were able to call up and get them to let the security guards let him up, because I definitely needed him there. I remember when we came off the elevator, there was a couple leaving the floor, and they were both just sobbing. And I just remember seeing them and thinking, that's so sad for them, but that won't be us, right? That's not gonna be us. We're just getting checked out. So I had another ultrasound there, and it was actually an MFM who did the ultrasound this time, right in front of me. As in I got to watch. And so basically she saw everything that had already been seen, but also she diagnosed that he had microcephaly, and a large liver and spleen as well. Things were just progressing. And most upsetting was that he had ventriculitis. So there was inflammation of the ventricles in his brain. So there was brain involvement now. I guess should I explain more about CMV and
Sure, yeah. I mean, I've never even heard of it before, so I would be interested to know if you feel like sharing.
That's where I was I wasn't sure where to put that in.
Yeah, no worries.
So with CMV,
did they at this point confirm that the CMV passed, or is this because you just did your amniocentesis?
Sorry, at this point, so then they did all the scanning, and then they did the amniocentesis, which was terrifying, to be honest with you.
Of course.
Because you always hear the risks involved with an amniocentesis, and it just felt so real and scary, and it wasn't confirmed until a few days later. They did confirm that baby had crossed the placenta, and he had the CMV virus. But at that time, the OB I was meeting with said, listen, we don't know yet, but this is because of CMV. It's meeting all the signs, the progression, he was I am 99% sure this is what we're looking at here.
Okay.
And with the rate of progression, it's not going to get better. It's not going, baby is not going to be okay. Baby's very, very sick, basically. Yeah. And it was just like lightning struck because it was just the odds of... Okay, CMV is an extremely common virus that nobody knows about.
Okay.
Everyone gets it. Pretty much everyone. By the time you're 40, I think it's something like 80% of women have had this virus. It's extremely common, but it's just like a common cold. So you don't know you have it. You don't get diagnosed with it. You don't go to the doctor for it. And it's not like, let's say, Fifth's disease that all pregnant women know about, because that one, there's like a sign, like the slap cheeks or whatever, right? So everyone knows to look out for that. But with this, you don't know. So
just be silent. Yeah.
It's silent. And anyone I've talked to about it, no one's ever heard of it before. So it was just such a shock, honestly. Your chances of getting the virus, if you have like a toddler at home, really increases the chances. And I did. I had a 19-month-old at home, and I was his mama, and we shared food and, changed his diapers. Did I always wash my hands right after? I don't know.
I mean, probably not. Who
Probably
does,
not.
right? Yeah,
Probably
who does?
not.
Yeah. But no mother does. I just want to make that, like, no mother does these things, right? This is so common, but we all do.
Why I'm like, it's extremely frustrating in hindsight, because of course no mother does. But if I had known about the risks, I would have, absolutely. And it's not, people are not educated on it at all. And it's a common virus. It's not that it's not common. What isn't common or likely is it for it to cross the placenta in the first trimester and have severe effects on the baby. So that's where the lightning struck, is like every worst outcome that could have happened is what happened to me. If it crosses the placenta in, say, the third trimester, the likelihood of it passing to the baby is higher, but the outcomes are way less severe. If any outcome, it can cause deafness. And I think it's actually the second leading cause of deafness in children, CMV. And again, no one's heard of this before, so I would have taken a deaf baby,
Of course.
I didn't want that either, but like for him. Anyway, so that's CMV. We're the unlucky ones. So they'll be basically said, I'm almost certain that's what this is, and counseled us on like basically what our options would be. And they said, your options are to terminate the pregnancy because baby's not getting better. Baby's only going to get worse. You could wait and see. There's a very good chance baby will pass in utero. Or if baby does survive, baby's life is not going to be he won't have any quality of life. Like what we would be looking at, according to them, was, developmentally delayed, deaf, blind, nonverbal, wheelchair bound, just devastating.
And obviously probably very uncomfortable, right? All the time.
He was sick. Yeah. He was so sick. And yeah. So suddenly we were considering something that I never thought I would ever consider. It had even been on my radar like earlier on with everything when I was researching online, and I was like, oh, I could never, But then once it's right in front of you and your baby is so sick, and my body was the one making him sick, which was so hard. Suddenly we had to consider this. And the doctor, like they would never, I was like, just tell me what to do. Like, tell me what I'm supposed to do. And they said, we can't tell you, but, and then they would go on and tell me like statistics of married couples who who have a severely ill child. And they talked to me about the effects it would have on my other son, whose parents would suddenly be at appointments 7 days a week. And they told us without telling us basically how they felt. So we decided to wait for the amniocentesis just to like confirm everything before we would decide for sure. And so that was a few days, like the hardest few days. And then we got the results and it confirmed that the CMV had crossed the placenta and he was severely affected by it. Not going to get better. So at this time I was just desperate for guidance, and I was in touch with, there's this wonderful doctor, Dr. Stuart Adler. He's like a CMV expert down in the States, and like he called me multiple times. Like I reached out to him. He's like, please just call me. I'll talk to you. And he like looked at the files and consulted with me. And I got in touch with a infectious disease doctor at Sick Kids. And I was like, what do you think I should do? Like, I was just like, somebody tell me. And everyone was saying the same thing. They're like, he's very, very sick. This isn't going to get better. So we made the decision, the worst decision that no one should have to make, to terminate the pregnancy at 21 weeks and 2 days. So we went to McMaster for this. Yeah. Sorry, just give me a second.
Take all the time you need.
Okay. All right. So they scheduled the induction of labor. Oh, so I should say I was given the option of, I guess he was still early enough along. I could have had an induction or what do you call?
The D&E.
D&E.
Mm-hmm.
But I just knew I wanted to meet him. So that was the way that I chose the induction. And weirdly enough, as awful as it was, I was so excited to meet my baby, you know, and find out if it was a he or a she. And I didn't want it to be like this, but I was still excited to meet him. So yeah, I was called into McMaster for the induction. It's just, this is all like a whirlwind. It's very hazy, but I remember meeting with a social worker, and I know other moms have talked about this as well, but she talked to me about like our options for like cremation or burial, and gave us, you know, recommendations of funeral homes in our area, and it all just felt like, how is this happening to me? You know, like, why are we having this conversation? This isn't how it's supposed to be. This was our like surprise miracle baby that, you know, this isn't how it's supposed to be. After that, we got admitted to the room, and basically what they do at this stage of pregnancy for us is they insert these like mesoprostol sticks into your cervix, I believe, which helps to start like soften the cervix and induce labor. So they insert it. It was like every 1 to 2 hours. I can't exactly remember. I just remember the very first one was awful because there was no turning back at that point. You know, like once that was in, I was like, this is
undo it.
You can't undo it. Yeah, so then that went on throughout the night. They couldn't really tell me how long it would be, or they, you know, anything like that. I remember my husband and I were just like, what do we do? This is, you know, like,
it's so weird. Yeah. Just so waiting for the most painful moment of your life.
Yeah.
Like, yeah.
I remember we watched Crazy Rich Asians. I was like, I just need something like light. Like, I don't know. And then
we watched, what's that show called? Stranger Things?
Oh yeah.
It's just such a bizarre time. No, but it's such a bizarre time. You're like, what do I do? I guess like pretend this isn't happening. Like,
pretty much.
I think you need like some sort of solace for a bit, right? And distraction. So TV can be really helpful.
Yeah, it was. And then we went to bed. I remember requesting a gravel. I was like, I just need to be like knocked out. Like, can you please? And then I remember being like, can you give one to my husband too? And they said, sorry, no, he isn't a patient. So I just like split mine with him, and we both had half a gravel just to try to sleep. They told me, so the labor pains were painful, but it was a very different experience than with my like almost 42-week birth, with my first pregnancy, obviously. And they told me once it was like time for baby to come out, it would come on like suddenly. It's just different when they're smaller, I guess, and the way that induction goes. And so it just seemed like, I labored throughout the night and nothing was really happening, and tried to sleep on and off. And then if there can be like any humor in this story, this is where it is. My husband, who always has the worst timing with going to the bathroom, decided he needed to go to the bathroom. And when he's in there, he takes a while.
As they do.
As they do. And all of a sudden, it just hit. Like the pressure, it was so intense. I'm like, he's coming. I remember crying, Cody, come here. It's happening. Like, Cody. And he's like, I can't, I'm going to the bathroom. Like, it was just, looking back, that was the one thing that's sort of comical, but at the time it was not. It was upsetting, of course, but he did get out in time. And we delivered our baby. I was secretly hoping, he was so young, but I was secretly hoping he might be awake when he was born, but he was born sleeping. The stress of labor was too much for his little body, I think, his sick little body. And this is hard, and I don't know why this happened, but I just remember they took him straight over to the examining table first. And it was so quiet in the room. And I just wanted to hold my baby, but he wasn't alive, so I couldn't even hear him, of course. And eventually, it wasn't very long, I'm sure, but they brought him over to me, and we learned it was a boy. And that was hard too, because we have a son already, so it's just, then you instantly are like, oh, his little brother, and what friends they would be, and all that kind of thing. Close in age, and
if they look alike too.
Yeah, and like he was so small, but he still was a little person, and they did have similar features, Anyway, he was beautiful. We spent, I don't know, something like 6 hours or so there with him. I was so tired, and I had been taking, I couldn't even tell you what it was now. Like I had like a pump, like a pain pump throughout the night. I didn't have an amniocentesis or anything, but so
epidural.
Not epidural, thank you. So I just like feel like I was sort of out of it the whole time, which I do kind of regret. But I still have memories of that time. I was sleeping and awake and holding him, and we got to sing to him and look at his little body and swaddle him and do all those things. So that was nice. But I remember my midwife came in to visit us in the morning, and so because we had like shared care at that time, and I was just like so proud to show her him,
Well, he's your baby. Yeah.
It's just so hard. The nurses were unbelievable. And I hear that time over and over again, but they held me and cried with me and, just listened and, got me through that time there with my husband. Another hard thing was because it was COVID. I don't know what we would have done if we would have had my son come meet him or not. I think we would have, but that wasn't even an option. No family could come meet him or anything. So I just remember when it was time to like leave, that I've been through some hard things. That was the hardest thing I've ever had to do. I just remember like, how can I leave my baby with these strangers? And then we did request an external autopsy. I couldn't think about having an internal autopsy done, but we did say yes to the external autopsy. So it was just a struggle though, just picturing him down in some like cold cadaver lab. And I just remember thinking, is he lonely? Is he cold? Like, like giving him all these human attributes, even though he wasn't alive. It's just,
Well, he's your baby, right? It's your job as your mother to worry about him and protect him. Yeah.
And I remember the nurses told me to like hug a pillow when I left, just to have something to hold on to. And we had our like box of things. So that is another regret of mine, is like take the pictures, because I don't know if it's because of the fact that he was like earlier in age or what. The nurse did. She's like, I'll take pictures for you. So I was like, okay, that's like. She took him to another room and dressed him and took photos of him. I was like, okay, that'll be good. That'll be enough, Sorry. But when I got the photos back after the fact, they were just like this bright lighting, sterile, like not the pictures I wanted. And normally I take so many pictures, but in that moment, I think it was just so, it just didn't feel right. So we took a couple of our own, but not very many. And
it's so hard to know what to do in that moment. And hindsight's always 20/20. And even the women that took so many pictures, they regret not taking more.
Yeah,
right?
I believe it.
Like, how many pictures would be enough? It never really is going to replace your baby being here, but I do understand. Yeah.
Anyway, so that was it.
I hope you're enjoying this episode. While we take a quick break, I want to speak to the moms listening who are in a very specific, very layered season. If you are parenting a living child after pregnancy or infant loss, whether you recently welcomed your rainbow baby or you are raising a child while grieving another baby, and realizing that this chapter feels a little more complex than you expected, well, I created something with you in mind. Because parenting after loss is not one story. It can look like holding your earthside child while missing the one who isn't here. It can look like loving your baby deeply while navigating fresh grief. It can look like gratitude and heartbreak living side by side. And that can feel incredibly isolating. And that's exactly why I created The Nest. The Nest is a supportive, ongoing community space for mothers raising a living child after pregnancy or infant loss. It's a space where you don't have to explain the coexistence of joy and grief, where identity shifts, relationship strains, nervous system overwhelm, and the very real postpartum experience are spoken about honestly, not minimized. Inside, you'll find trauma-informed postpartum doula support, 2 virtual community calls each month, and most importantly, a village of women who understand this season without you having to translate it. If you've been looking for your village in your Earth Mama era, whether that season feels joyful, heavy, or somewhere in between, you can learn more at thedoulalife.ca/nest. And if you do decide to join us, please use promo code NEST1 to get your first month free. Okay, now let's get back to the episode. What did life did you guys decide to, do anything in memory to say goodbye or in ceremony for your baby as a family?
Yeah. Well, first of all, I will say that my toddler at home was like my rock, honestly. In that, I just had to go on for him. It was Christmas time all of a sudden, and I still wanted to make that special and magical for him. And, I remember a few weeks after Calvin died, we went to a Christmas tree farm, and I remember thinking, this feels so weird. How could we be here right now? But also, I was also happy to be there with him and to be doing those things with my living son. And, so yeah, I feel for moms who go through loss with their first pregnancy, because it would have been, I think, much different had I not had him at home with me to kind of bring me out of my sadness and get me off the couch. You know what I mean?
Totally give you a reason to get up in the morning, right?
Yeah. And at that age, they're so needy, it didn't give me much opportunity to just sit around. So,
Well, and it serves as an outlet too, because, there's that quote, grief is love with nowhere to go. And you
yeah,
have all this love, and you did have your toddler at home to just kind of
yeah,
pour into when you could, right?
yeah. So with
Mhm.
with that in mind, I was still breastfeeding my son,
Mhm.
and so I never even thought like, oh, your milk will come in. I was like, my milk's in, so it didn't even
Mhm.
really occur to me. Like I think they mentioned it at the hospital, but it didn't really occur to me. But no, it my milk came in the way it does
Mhm.
when you have a newborn, right?
Mhm.
So all of a sudden, like my breasts were hard, and and like I had the colostrum, and
Mhm.
um, it might sound weird to some, but to me, it felt so special to give Callum's milk to Declan.
Mhm. Mhm.
Yeah.
That would be really special.
hmm I remember, I remember when he like I was feeding him, and he kind of like pulled back and looked at me. He was like, "Huh? Like what is this, Mom?" And then he's like, "Okay," and
It's
then
like a
just
treat for him. Like,
yeah, the good stuff,
uh,
right? Like
yeah, like I just am thinking, like, what this is like side combo. I don't know if I'll put this in the episode, but like, what I can't imagine, or I can imagine what that would be like, and it would just be, yeah. So I don't know. I can't even think of the words for it, right? Like special with your toddler, but also, yeah, I don't have the words, honestly. That it would be so unique. And I'm definitely feeling that with you. And what a beautiful thing to be able to give your baby. I know for us, we froze my milk in
yeah,
hopes of giving it to
our
hopefully
future
our
baby.
next baby,
Mm,
so that's so special that you got to share that with him.
yeah, yeah. It
Mhm.
was like a comfort to me for sure.
Like special, but also like, ow, you know?
Yeah.
Mhm.
Yeah. I mean, because I was breastfeeding him, it wasn't like the same ow as like with a newborn who's just learning how to like, you know,
Mhm. Mhm.
suck
But
and
like
swallow
ow
and
in
all
your
that.
heart, like knowing that
Oh,
this milk was
yes.
meant for your other baby, right?
Absolutely.
Yeah,
Yeah.
it's a bit of that, happy and sad, right?
Exactly.
Yeah.
Yeah. The duality, there's so many dualities, right? But
Mhm. So what
um
did life kind of look like for you guys afterwards? Because obviously, you did go on to have your rainbow
mhm.
baby. What did life look like, in the aftermath with you and your husband? I know that some of us fit into like two different camps, and it's either like, I need time to process and explore this and, turn over any stones that might need turning over. Or some people are like, I'm good to go. Like,
Yeah.
next cycle. Where did you kind of fall in that, especially if your milk came in and you were now all of a sudden breastfeeding your toddler in a different way?
Yeah. Um our situation was unique in that we lost our baby because of a
Mm-hmm.
virus. Sorry.
Mm-hmm.
So we were told to wait.
Mm-hmm.
We had to wait until well, like obviously they want moms to just kind of like recover and everything, but
Mm-hmm.
the markers, so the IgM, like in the moment markers, meaning you have like an active infection, they wanted that like to be totally resolved. So that
Mm-hmm.
hangs around for a while, I guess.
Mm-hmm. And what did it look like, treating that?
There's nothing to time.
You just, okay.
Yeah, I remember I was seeing my naturopath at the time, and I think she had me on some like immunity booster. I was like, just give me anything to help,
Yeah.
but there's
Yeah.
no treatment for it. Like I wasn't sick anymore. I just had it like lingering in my blood, like the
Mm-hmm.
inflammation or the infection. So,
Mm-hmm.
um, and again, I remember consulting with that doctor, Dr. Adler in the States about it and trying to get his like expert advice because he's the like leading expert in the area. And um, I was basically told like once I was given the green light that it was not impossible that it would happen again,
Mm-hmm.
but it would be like lightning striking twice. So like highly unlikely basically. And
Mm-hmm.
um, that was scary though
Of
because
course.
it's hard to trust after something bad happens to you. Like why not again? Why not? You
Well,
know?
when you've hit the odds before, right? When
Yeah.
the lightning is already struck,
Yeah.
why wouldn't it strike again, right? You already hit the odds. So it's like,
hmm
once you know that this can happen and it can happen to you, it's really impossible to unlearn that. right?
exactly. Yeah,
Mm-hmm.
exactly. So eventually, I think maybe because we wanted to have another baby. We wanted to give our brother a sibling, his brother a sibling. But it was also just terrifying. But we were eventually, I think maybe like 3 months postpartum, they said, okay, like the virus is gone. Like, you're okay to just start trying whenever you're ready to. And I think we waited a couple more months. And then just threw caution to the wind, and it was terrifying. But like my desire to have another child, I think outweighed the fear, but the fear was still very much present. Suddenly you're just like so aware of like, I never heard of this before. So what else is there out there that I've never heard of before, let alone all the things that we do know about that can go wrong. And so I got pregnant, I think about 6 months after we lost Callum, 6 or 7 months. And it was scary. I was followed by my, MFM again this time. And I don't think it was so much because they were worried about the infection, because they said like you're in the clear, but I had a history of high blood pressure in pregnancy, and also I think they just like wanted to give me that peace of mind. Like I think, anyways, like I felt that way, and it was not, like hard to go back there, but also nice to go back there. And
well, speaking from personal experience, McMaster is an amazing hospital, and the doctors, I feel, doctors do care. They are human, right? They do care about their patients, and they do want to see us win, right?
Yeah.
They want to take care of us. Yeah.
Exactly. And I very much got that impression from my doctor, my MFM, who we had for both pregnancies. Yeah, so those 9 months were just like a blur, but I think particularly the first 21 weeks, like until I had that anatomy scan.
Yeah. Did they have to do like different genetic testing this time, or did they do any other, deeper investigations? Or
they did this time. I never really opted for it in the past, but there were a couple markers on Callum, like he had lower set ears and a shorter nasal bone. They never determined that it was anything, and it might have just been related to the virus. But knowing those things and my advanced maternal age at the time, I think it was 35. We opted to do those things. Yeah. I don't remember the names of the tests, and everything came back clear. But even that didn't feel safe, because it's like, well, I could just get sick and that could kill my baby, basically. So I was very, 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 very anxious up until my anatomy scan, because that's when they do their like in-depth look at everything, and thankfully everything came back clear. And I remember like I had built it up so much in my head, and then I see a doctor, and it wasn't my regular OB, and he's just like, "No, your baby's good." And like that was basically our conversation.
You're like, wow, this is a very different experience.
Yes. Yeah, exactly. Yeah. And then there's something I want to go back and say, but I don't know if now's the time. Go back and say it. Sorry.
No worries.
There's I'm sure there's other things too. But I guess I didn't really talk on like right after the fact that it was COVID, and everyone was in isolation at the time. It was very hard because we weren't allowed to have like anyone visit us. I had some friends break the rules. Like it was just such a weird time, but I still felt, thankfully, like we felt surrounded and supported by our community and our loved ones, like through meals sent and calls made and flowers, and just like we felt loved on, but it was still very, very hard and confusing really to like go through all this alone. Do you know?
Well, especially being at home with the toddler too, like not being able to like get out and about, and it's kind of a double whammy.
Yeah. Yeah. And something else I wanted to show you. So you had asked about special things we did to honor him. We have we got a Molly bear. I know you said you have a Molly bear as well. This is our Callum bear.
So
and
cute.
Yeah, So Callum means dove, so that's why the dove on him.
I love that. I actually recently just heard that Molly Bear went out of business, like in the last couple months. Yeah.
That's devastating. Because
Yeah.
I can't tell you, like, the comfort of this bear coming in the mail and weighing the exact same as my baby, and just like, and he's a part of our family. Like, honestly, like, I would highly recommend something like this for other moms, because this is how we talk about Callum, through Callum Bear.
And it's such a like tactile thing for your older son to be able to hold and to understand and to kind of, tie in with him as well, right?
Yeah. Oh yeah. He sleeps with him every night, and like he'll go through phases, but like lately he's very like aware of his brother and talking about his brother, and I'll go to like tuck him in, lay with him, and he'll be like, "Here, mommy, do you want to hold Callum Bear?" Like, he knows how important it is to me.
For anyone that's listening and not watching, Molly Bears, or Callum Bear, is a weighted teddy bear that there's other organizations other than Molly Bears, but it's a weighted stuffy that's usually the same weight as your baby, that you can kind of feel their, one of the things after we lose our babies, there's like that physical ache just to be able to hold your baby in your arms. And Molly Bear, Callum Bear, is being able to have, almost a replica of what it felt like to actually hold your baby and feel their weight in your arms. I know our Molly Bear is so special. And when we got it in the mail, there's like those days in your grief that really stick out. And I'll never forget the day she came in the mail and I got to pick it up again, because it really is just that feeling of like remembering what it was like to hold your baby. It's so special.
And even though Callum was small, I think he weighed 300 grams. He's still heavy, like my son, why is this bear so much heavier than the other bears? And because it weighs the same as your brother when he was born, and like that kind of thing. So it just gives kind of like an outlet to talk about him, which is nice.
This is the process, right, of like processing our stories, like remembering all the bits and pieces.
Yeah.
So why don't you take us back to your anatomy scan? We had our anatomy scan. Everything was looking good.
Yeah.
You still were feeling, a little bit of that anxiety, a lot of that anxiety, of course.
Yeah.
What did kind of things look like for the remainder of your pregnancy?
Remainder of my pregnancy, I did feel some relief having passed that point, having known that baby was not sick. And I was having regular scans because I was with the MFM. So that was both stressful and comforting to me, because like you said, they can find things if you go looking. And
then it's like building yourself up for those scans and the potential news. It could be, I think you have to choose like which one's worse, like not having them and avoiding it, or exposing yourself constantly to that potential.
For me, I think it overall was the right choice. It was helpful for me. And lots of therapy. Lots of therapy was very helpful for me too. My therapist was wonderful, like wonderful. Like during our loss, and just calling me and talking me through it. We went on like COVID walks, we called it. We would do walk and talks outside because we weren't allowed to like be in the same room together. And so she made it work, for me. And I can't thank her enough. Yeah, so then we were excited to meet our baby, but scared. And I was definitely in that mindset of like, oh, he's definitely going to come earlier. Oh, he's definitely like, it's just hard to trust. But the plan was to induce at 39 weeks. But they didn't want, because of my blood pressure and everything, basically, that they weren't going to let me go over this time. And I went in at 38 weeks. And my blood pressure had like spiked. So they wanted to observe me. And then it was decided, no, we're going to induce you tomorrow. So at 38 weeks. And also my OB was off the following week. And I know she wanted to be there for my birth. So I feel like partially there's something to do there. But yeah, so they inserted the Foley catheter balloon, sent me home, which was very nice just to go home and kind of like collect ourselves and come back the following morning. And yeah, so the balloon fell out within a few hours at home, I think, the catheter. And at the hospital, let me think. So they induced me with, what do you call that drug?
Pitocin.
Pitocin, thank
So
you.
Pitocin is a synthetic form of oxytocin.
Thank you. In my first labor, I was also induced, and they did the Pitocin and the water breaking at the same time, and I had just like a very bad experience. So I was very nervous this time, and I advocated for myself. I'm like, one at a time only, please. And that's what they did. I had my midwife there as well because of the shared care, and she was there with me through everything with Callum. So we weren't allowed 3 people, so I couldn't have had a doula, although I would have liked to have had a doula at this time. But she kind of like was in place of that, I guess, because if there's like a shared care environment like that, the midwife isn't the one delivering the baby, but she was there. So
she's more so there for emotional support.
Yeah, which is really nice. So nothing was really happening. So a few hours later, they decided to break my waters. And then that's just what kickstarted everything. And I got an epidural this time, which was wonderful. Yeah. And I was just determined to get him out, like now. You know what I mean? So once it came time to push, it still took a little while. I think about half an hour. But towards the end, I remember them saying to me, "Oh, wait, like the OB's not here yet. Like we need to get the OB." And I was just like, "Nope, he's coming up. This baby's getting out of me alive now. Like I'm not waiting." So a nurse caught the baby, which apparently was very special for them because they like rarely have that opportunity.
For sure.
And yeah, we found out it was another boy. So a third brother. I don't know what I wanted. Like he was what I wanted in the end. Part of me wanted another boy so my brother could have a brother. Part of me wanted a daughter so that it wouldn't feel like I was replacing Callum. But I mean, I wasn't. And Callum's still very much a part of our family too. And yeah, so that was Landon. Our Landon was born.
What was that moment like, just knowing that he was finally here?
Such a relief. Such a relief. I remember I just like burst into tears, and I remember a nurse saying, "Oh, why are you crying? This is happy," or whatever. And like she obviously didn't know everything, and I was just so overcome, with emotion, happy and sad. So, yeah. So it didn't go perfectly smoothly though, but he was alive and he was here, and that was like enough, But because he was born early at 38 weeks. Oh, and they had put me on blood pressure medication the day before.
Oh, okay.
That one day of blood pressure medication caused him to have low blood sugars. And so he was very, very, very sleepy, and he wasn't feeding well. And so he did end up having to have a NICU stay, which was overwhelming. Not like how I wanted it to be. But I trusted that he would be okay at the end. Like I didn't feel like, at that time I didn't feel like he's going to die. You know what I mean? So he ended up needing like IV antibiotics. He was tube fed, like nasal tube fed. So I couldn't breastfeed him the first couple of days. That was hard as well. But eventually he got kind of squared out. The IV, I think, really helped. And we were discharged about 6 days later. And that was when, and again, COVID, so my son could not come to the hospital and meet his brother. I remember we were at McMaster, and we went to like the coffee shop, the Williams or whatever, across the street, so I could see my son and like, tell him about his brother. But yeah. So we then we finally got to bring him home, and that was just the best moment ever.
Of course.
Yeah.
What did what did life kind of look like for you guys after bringing your baby home? What did that look like for you?
Yeah, just we were in the newborn bubble and navigating life as a family of 5, but family of 4 at home, and it honestly was a joyous time. Yeah. There was it was like very, bittersweet, of course. But there was a lot of joy for sure. Yeah.
Other than, your calendar and, involving your calendar a lot into your family, like what other ways do you keep your baby's memory alive especially with your sons?
Yeah. So we actually have it right here. We have his cremated remains. This is his urn. I'll show you guys because it's very special to us too. So it's a candle. So we light it, and when we're lighting it, we're thinking of Callum, So that's another way at home. We celebrate his birthday every year, which is very bittersweet, but for the boys, it's cake and it's fun and they look forward to it, so that's nice too in its own way.
Well, it's your birthday too, right? And you deserve to be celebrated that day as well. Yeah.
And I'm trying to think, I talk about him, and not always, but sometimes I'll bring him up, even if I know it's not comfortable for other people, just because I feel like I need to. So the other night we were at my son's swimming lessons, and I was talking to a grandma there, and she was talking about she had 3 sons, and I couldn't say I have 3 too. I had to tell her, I have 3 sons too, and so I'll take those opportunities when it feels safe and right to share him. Yeah, and we talk about him all the time. He's definitely a part of our lives. My older son is interesting now that he's 6. You see some of his grief too come out. Sometimes he'll say things like, I wish I had Callum here. I wish he was my brother, or just little, he understands to a certain extent.
And children are so honest, right? And I'm sure his comments and his honesty and how he processes and makes sense of all of this, something that doesn't make sense, right?
Yeah.
I'm sure that will change and evolve a lot throughout the years as he gets older. And he looks to you because you're his mirror, right? Of how we feel about this as a family and how we're going to navigate, honoring him and talking about him. And yeah.
It's interesting that you say that mirror thing, because he totally does. He'll be like, Mom, here's Callum. He knows he gets some sort of reaction out of me, and yeah.
Yeah, I love that. Well, Nancy, thank you for giving us, a glimpse. I know it's so hard to convey how big this feels and how much of a piece of your heart this actually is. But I'm just so thankful for you to give us a glimpse into your experience and your journey of, being a mom of 3 boys. And I know that there is another mother who's listening to this today that's going to feel, validated in her experience. And you're going to be her mirror of what she's experiencing as well. So just want to thank you so much for agreeing to come on and being with us today.
Thank you for having me. Honestly, it's scary to share, but at the same time, all I wanted was to hear stories like that I wasn't alone, during my experience. And they weren't really out there, it's hard to find them. So I'm happy if it makes even one mom feel a little less alone.
Well, I'm glad you get to be that person for someone.
Thank you.
If this episode resonated with you, would you mind sharing it with another mother who might need to hear it? Sometimes the smallest act, like sending an episode to a friend or sharing it in your stories, can remind someone they're not alone in their grief or their hope. If you do share, please tag at the Rainbow Connection podcast so we can continue to spread these stories together. Thank you again for tuning in today. And remember, you are never alone. I'll see you in the the next episode.